Alright, so today we'll be starting with the topic of chemotherapy, and this is the introductory chapter on chemotherapy. So chemotherapy is made up of two words, two terms, that is chemo and therapy. So chemo means chemicals and therapy means treatment. So it is a treatment of a disease by the use of pure chemicals which have specific antagonistic effects on the organism causing the disease. Okay. What this is basically trying to say is, this much is basically trying to say is, this underlined highlighted portion, this is trying to say is that chemotherapy is the use of pure chemicals. We use pure chemicals. They can be either organic or inorganic, that is natural or synthetic or semi-synthetic. And these pure chemicals have specific antagonistic, that is inhibiting effect on the organism causing the disease. And this inhibiting effect or antagonistic effect is actually in the form of by the inhibition of particular metabolic process, which is very important for the survival of that particular disease causing pathogen. Okay. So the action is achieved by the action of how this action can be achieved. Antagonistic action is achieved, as we already discussed, that it can be achieved due to the fact that that particular drug or chemotherapeutic agent will interfere with the metabolic process, okay, of an organism. So examples can be by antagonizing the enzymes, or there is antagonizing the enzymes, that is by inhibiting the enzyme production, or by preventing coenzyme formation. So coenzyme formation can be prevented, or enzymes can be inhibited, the production of the enzyme can be inhibited in that particular bacteria or pathogen. Okay. Now chemotherapy is in practice empirically for centuries. So this basically means, empirical means on the basis of personal experience, not any scientific knowledge. So empirically chemotherapy is used for centuries. For example, quinine has been used against malaria since 1630. But Paul Ehrlich was the first person to give the principle of chemotherapy in 1900. Okay, so Paul Ehrlich is known as the father of chemotherapy, and according to Paul Ehrlich, he defined chemotherapeutic agents as the compounds produced by systemic search for chemical which should attack infecting organisms without harming their host. Okay, he stated that chemotherapeutic agents should be maximally parasitotropic and minimally organotropic. So what this is basically trying to say is, that Paul Ehrlich said that chemotherapeutic agents are the drugs which will act in a certain way that it will attack the infecting organism, but it will not harm their host. That is, they have maximal parasitotropic action and minimal organotropic action. Tropic means affinity. Tropism means affinity. So it will have maximum affinity, or its habit or its action will be on the damage to the parasite, and minimal on the organotropic, that is minimal on the host. Alright. Now he also gave the therapeutic index, which is the assessment of the therapeutic value. And therapeutic index, as we already know, is defined as median lethal dose upon ratio of median lethal dose to the ratio of curative dose. Okay. Now the wider the index, more valuable is the drug. Obviously, the wider this will be, the more will be the value, more valuable will be the drug. Alright. If we move on to the next page, then this point. The original, so this is not important. Now, there is a general notion that most of the antibiotics or most of the chemotherapeutic drugs are produced only by microbes. Antimicrobials are produced by microbes only. This is not correct. Though the commercial production of chemotherapeutics is done only by microbes, but there are various plants such as buttercup family, cabbages and algae which yield active antibacterial products. Okay, lysozyme produced in tears, in various fluids like tears, has enzymatic destructive actions on certain bacteria, and larvae of certain blowfly. So these also produce some antimicrobial products. Okay, thank you.